Dear ladies and gentlemen, it's a pleasure to be here today to try to explain to you something about our Lameness research going on at the School of Veterinary Medicine at the University of Wisconsin in Madison. I have been asked to try to explain why I believe that the reality of this endemic infectious claw disease, being digital dermatitis, needs special attention when it comes to effective preventive and control measures that with an eye and an aim on the long-term effect of whatever interventions we are taking. My name is Dopfer. I'm German of origin. I'm an assistant professor here at the vet school in food animal production medicine. You can Google me, you can find my email address. If you have questions, please don't hesitate to contact me. Digital dermatitis has many faces, and we have to realize that after 30 and 40 years of news about digital dermatitis seems to be here to stay. The claw health advisors for producers, hoof trimmers, veterinarians, they have failed in a way to eliminate this disease from the cattle farms that have intensive animal husbandry. And because for the time being this disease is here to stay, I would like to convey 3 key messages today that are to rekindle your awareness and thinking about this disease that has led to a lot of resignation in terms of what are we to do about it. We just have to learn to live with it. So 3 key messages. First one being, when you lift a foot to treat acute active red ulcers of digital dermatitis that we saw on the slide before, you're basically too late. Because the treponemes, those are corkscrew-shaped microorganisms, bacteria that are strictly anaerobic, so they die in the presence of oxygen. Those treponemes, they will have penetrated deep into the epidermis and dermis, the deeper layers of the skin at the skin horn border of the feet, and therefore digital dermatitis has long-term consequences. It has long-term been, for a long time, been considered to be just a short type of disease. You lift the foot, you treat, and the cow heals and is not a problem anymore. That is not true, because the recurrence rate of digital dermatitis lesions is extremely high. So again, when you lift a foot to treat DD, and you do that with the type of awareness that I would like to initiate in your thinking today, you're basically too late. And that puts a particular emphasis on preventive measures. Second key message being, the dynamics of digital dermatitis are driven by chronic DD lesions and not by the active acute so-called M2 lesions, as I will try to explain later on, alone. So we are very fixated on detecting and treating these red acute ulcers, but what really needs attention and more attention are the chronic lesions, because they represent reservoirs of infection for your entire pen of cows where this cow is situated. We need for an integrated prevention and control program that kind of embraces the entire lifetime span of a cow, from being a calf to the heifer to the lactating cow to the dry cow, and particularly the young stock being heifers and calves. They do not actually receive the attention in terms of prevention and control of digital dermatitis, while we know by now that particularly heifers that have had acute and repeated episodes of digital dermatitis, they are prone to become recurrent cows later during their productive lives. So whatever we can do to digitally precondition those heifers before they ever calve in order to have as few DD lesions as possible and be under the impact of as few risk factors in terms of digital dermatitis as possible, we're giving them a better start into their productive lives. And there's one saying, if you choose to use a hoof bathing strategy for the prevention of digital dermatitis or other infectious claw diseases, you have to know something about these diseases. And with the special focus today on digital dermatitis, you have to know about the optimal dimension and design of these hoof baths, and you have to know something about the behavior of the cow interacting with these hoof baths, or your hoof baths are not the best investment you can do. And then we have one goal. We want to reach what is called a manageable state of disease, and that manageable state of disease is defined under 3 different columns of attention points, being animal welfare constraints, because lameness is a welfare problem, and it is often not even perceived as a problem. the manageable state of disease has to be achieved under economic restraints, because there are costs for therapy and prevention. There's labor involved. There are cullings due to lameness, and we cannot do just whatever we want. We have to be very conscientious and very strategic about our investments when it comes to intervention against digital dermatitis. And there's a public opinion about how cattle are kept. Farmers, they feel abandoned by their claw health advisors, and we are under crossfire with regards to how society thinks about our animal husbandry, and there's a very different, there are very different levels of problem awareness that we can try to assemble into like a collective ambition, I would say, towards mitigating this infectious claw disease and all the long-term sequelae that come from it. I believe that the manageable state of disease being defined as the state of disease where the farmer or claw health advisor realizes the disease is here to stay, we are unable to eliminate it, but given our labor and investments into prevention and control, we are able to create an endemization of this process where we can say, okay, the disease is there, there's the occasional active M2 lesion, this red ulcer, but I can live with this situation. I know how to detect it, I know how to treat promptly, I know how to prevent using strategic hoof baths, and how to mitigate my risk factors. From here, I want to emphasize again that this is a lifetime endeavor in terms of thinking about the cow's life, where we are currently not paying enough attention to this heifer and young stock stage. We are very drilled and fixated upon detecting these acute lesions during the lactation, even throughout their dry cow periods. We should pay more attention as to what is the history of the cow, what can we do in terms of preventing new lesions from happening before this dry cow enters into her new lactation. So we have to be aware of periods of change, the assortment of cows and heifers, transition periods around calving, and other risk factors that determine the epidemiology of digital dermatitis, such as purchasing infected, subclinically infected heifers and cows, unhygienic, bad hygiene conditions in the barns, seasons that may be predisposing towards outbreaks. So there's a lot around digital dermatitis beyond just detecting an acute lesion. I talk about the M stages that have been determined or have been defined in the early 90s, actually, and published in 97 and again in 2012, where we define that M0, I'm pointing at it right now, that's the healthy horn skin border, where if you imagine rolling the skin between your fingers, it's a very subtle, very bendable and flexible type of skin. From here, particularly in the young stock, you see that there are small focal keratolytic epithelial lesions, and they have about the size of a penny. If you imagine pressing a penny into your own skin, that's about the dimension of lesion and the depth of lesion you achieve. These lesions already harbor treponines, which are part of the causal agents of digital dermatitis. So from the M1s, which keep kind of appearing and disappearing within about 8 days, they come and go and come and go, independent of whether you treat them topically or not. These M1 lesions are the early and intermediate stages of digital dermatitis. Nobody really pays attention to them. And M1 can develop into M2 when they reach a certain critical diameter of the lesion, which we determine to be about 2 centimeters. Based on observational studies where we followed the cows, these M1 lesions that come and go suddenly reach a critical diameter and then bloom into these full active painful ulcers, which we call M2 lesions. And from the M2 lesions, when you treat them topically, you can expect that within about 1 to 2 days, and this is what you see here, the lesion covers itself with a kind of sturdy scab-like, like a wound scab cover, and that M3 stage is present only for a rather short period of time, about 7 to 10 days, after which the scab falls off. And what appears from it could be the chronic lesions, being M4, where you have hyperkeratosis. This is the area, this is like a shadow of the former lesion. This would be the M4 area. And M4s, if you imagine rolling this skin or even the proliferative stage of digital dermatitis between your fingers, That's a very sturdy, very thickened type of epithelium. And you have to imagine that these chronic stages are your reservoir of disease. The treponines have descended deep down into that very alterated tissue where the systemic immune system seems to have no access. And here's one more detail. These treponines, they are not corkscrew form like anymore. They are encysted. They go into some kind of dormant stage. If you imagine that you're trying to treat something here on the surface, you will never reach those dormant stages, those encysted stages of the treponines anymore. So part and the focus of our preventive program should be towards preventing these chronic lesions from happening, because it is particularly what I call the M4 stage, M4.1 stage, the M4 stage, which is the chronic lesion, being proliferative here, being hyperkeratotic here, the big lesion. And 0.1, because there's an early stage, intermediate stage here at 1 o'clock. This is an early lesion, like the one we saw here, but then with the background of a chronic lesion. So this is an early stage lesion of digital dermatitis on top of a chronic one. Here's the chronic M4, this is the M1, and this is why we call these lesions M4.1. It is these lesions that exacerbate into M2 lesions, particularly under the impact of certain risk factors that I mentioned before. And you want to initiate a long-term, very standardized hoof bathing project or program to make sure that these lesions do not cross over into the M2 lesions anymore. And this involves as well the mitigation of risk factors that may be affecting your cows. So these are the M stages that are part of the population dynamics for digital dermatitis. And I want to focus again these chronic M4.1 lesions that have these early stages on top of them, early stage and chronic stage. The benefit of your hoof bathing and preventive program is from keeping these guys to exacerbate into the big lesions, the acute active M2 lesions. And I want to make this a little bit clearer. Not every cow is the same. They're not alike. Therefore, we type our cows. A type 1 cow has no M2 lesions, does not have these red active lesions over a prolonged period of time. It is astonishing. Every farmer knows the cows that never come down with digital dermatitis problems. Then there's the type 2 cows, which are the ones that develop like 1 M2 lesions and then have shown no recurrence over prolonged periods of time. This is about 30 to 60% of the animals in endemically affected farms that have this type 2 type of pattern. And then there are the problem cows, the type 3 ones. They have more than 1 M2 lesion episodes over certain defined periods of time, and that could be a summer, a study period, a year, however long you define that period of attention. And the type 3 cows, again, are the core group of cows that the farmer knows those cows because they are his problem cows. Those are the ones that keep coming back every fortnight, every 10 to 14 days with a new acute lesion. They have to pull them out and treat them repeatedly. But there is another side to these type 3 or problem cows, which is you can use them as indicator cows. If that core group of type 3 cows is known, you can use them as indicators which under certain impact or risk factors or in times of outbreaks or even before outbreaks, they will become more severely affected. So when you notice that, when you are aware of your type 3 cows, you can use them as sentinels, as indicators as to what is happening, and you could intensify your preventive measures before an acute outbreak ever happens. There's nothing magical about the prevention and typing of cows, the discovery of M stages. You just have to be stubbornly persistent and install this long-term vision of an integrated prevention and control system. I was talking about individual lesions, and very commonly they are to be detected early, and I'm going to explain to you how I think this should be done by means of what I call the DD pen walks later. Topical treatment means you have to detect early, treat promptly with, for example, a standard antimicrobial treatment such as oxytetracycline. You don't need something magical, something exotic. Just be very persistent about it and be aware of the fact that although the lesion may seem clinically cured on the outside, the microbiological cure, that is the presence of these treponemes that may be insisted or not deep down in the skin may lag behind your clinical cure. So there may be clinical cure on the outside while the microbiological cure on the inside is incomplete. And please be reminded, treponemes insist. Nobody knows how these insisted treponemes react to antimicrobial treatments, chemical impacts, or pH changes. And those are exactly the things that we are doing in order to prevent and treat digital dermatitis. Then there's the question about to wrap or not to wrap. If you choose for a wrap after topical antimicrobial treatment of these acute lesions, please apply a light wrap that is to fall off within 1 to 2 days after applying this wrap, because if they are left on too long, then you're creating an optimal anaerobic climate for these treponemes to thrive, and then you may create a chronically affected cow that then recurs, and then you're further away from your goal than you were before. And while you're treating topically, please be aware that you have to mitigate your risk factors at the same point in time, or the prognostics of having your topical treatment succeed, they are going to be pretty bad. Topical treatment to me means you have to monitor your recurrent cows and keep them under close watch. If you discover an active acute M2 lesion in whichever type of cow, then you have to preferably lift the foot, clean it with a disposable paper towel, clean particularly that little pouch here at the caudal end of the interdigital space, because there's this little packet of manure that resides in there. This is where many of these N1 lesions kind of reoccur. We apply a 2 by 2 inch gauze sponge, which would be about 4 by 4 centimeters gauze sponges with about 10 milligrams, the equivalent of 10 milligrams of an tetracycline. Here in Wisconsin, it's very common to apply a light wrap, and if you do that, then you have to release the cow onto a relatively clean surface, like a scraped barn in the face of the head gate where the cow goes to feed, and then you can expect that this M2 lesion is going to cover itself with this scab-like wound cover that I call the M3 or healing stage of digital dermatitis within 1 to 2 days. Here is an example of such a light wrap. Less is more, once around, once through with the gauze sponge in place, and you release the cow onto a clean surface, and then you can expect this to stay in place for about 30 minutes, and this is about the action time span for the antimicrobials. I was talking about prevention and control, and particularly prevention using what we call the ideal hoof bath, as published by Dr. Cook et al. In 2012. And I copied the link to the website here at the Food Animal Production Medicine Group, where you can find a video about how this ideal hoof bath is built. Basically, we are trying to restrict the volume of these chemicals to a minimum, but then an efficient minimum in the sense if we have to use, for example, copper sulfate solutions or other biocidal solutions, be aware of the workers' health aspects of formaldehyde, be aware of the environmental impact of these copper sulfate solutions. Therefore, the restriction to a volume here, where we have a relatively high instep, 25 centimeters instep to the hoof bath. We want the cow to come walking crisply towards the hoof bath, slow down, enter the hoof bath in a very conscientious way, and then move through by taking 2 dunks through these up to 3.5 meters long hoof baths, and at the end she steps out of there. There's no way to evade the hoof bath. The walls are closed, so there should be no light and shadow place on these walls, because cows that look into light and shadow games, they startle, they stop, and they start to defecate into your hoof bath solution. So fluid movement of these cows through the hoof baths, that's part of the behavioral interaction between cows and hoof baths. We believe in these diagonal or angled side walls, because that allows the cow with her big abdomen to move through, while really the width of the hoof bath is rather narrow, and that restricts the amount of hoof bath fluid in there. We want an efficient way to clean this hoof bath after about 150, 200 to 300 cow passages. That depends on how many cows go through, how filthy the claws are. We have lab tests to determine whether the hoof bath fluid is still able to kill bacteria in vitro, and I think it's part of the good practice application of this ideal hoof bath to have like a pre-screening test as to the chemical that you are using, which may be something that is not the standard type of chemical, whether this chemical candidate really kills our bacteria in vitro, being the treponines. And we are trying to motivate people who are innovative in terms of introducing new chemicals to pre-test them in the lab first. Once the chemicals have shown their efficiency at killing and inhibiting the growth of treponines below the working concentrations that they are aimed for in hoof baths, then we would feel comfortable with having these new chemicals tested in the field. And you have to see that this is part of like the improving the welfare of cows, because if you throw these chemicals at the cows and there's no effect, you're creating more chronic lesions, and that is not what we want to achieve. From here, I want to kind of summarize what I believe is true about the population dynamics of digital dermatitis when it comes to DD prevention. The prognosis of treating an M2 lesion topically depends on the history of the cow. There's a difference between cows. Not all cows are equal, so it is a difference whether you're treating topically a type 2 cow that has had one contact with an M2 lesion versus a type 3 cow that appears with an M2 lesion on top of the chronically proliferated tissue that she already had. So the prognosis depends on whether you're facing an M4.1 lesion that has exacerbated into M2, or whether you're coming from a first contact and have an M2 that originates from an early lesion there. The ideal hoof bath would prevent the transition from here to there, from M4.1s into M2s. The ideal hoof bathing prevention program for digital dermatitis would make that these M2 lesions would not exacerbate or would not result in an increased number of M4 and M4.1 lesions. The bad hoof baths, and I say bad in this animated way, to say this favorable hoof bath will create more chronic lesions, a higher reservoir of infection, and increase the likelihood of these DD outbreaks in the long run, and farmers should be aware of that. I want to motivate you to use what I call DD pen walks, which is cows in head gates, could be heifers in head gates, or feeding at the head gates here in the barns. You should go through behind those cows and try to spot your M0 lesions, your M4 lesions, the chronic ones, and the M2 lesions. And you can do that by walking behind the cows. While the farmer is doing that, or the cow health advisor is doing that, you're thinking about your risk factors at the same point in time. You're thinking about who is possibly making this transition from chronic into M2s, and this periodic early detection. I can do about 100 cows within 10 minutes, and I can teach this to you. This is very easily transferable between people. If you know what you're looking for, you can spot these lesions. You can pull out the M2 lesion and treat them promptly. You want to use this and record which cow's identity has which lesion, and if you do that 4 times within a period of like 4 times 1 week spaced apart, my type of skill, my type of mathematical model, I can use those to predict an outbreak before it ever happens. We're working on producing an app where I imagine my farmer walking with his smartphone behind the cows and kind of typing in cow A has an M2 lesion, cow B has an M4 lesion, and if you keep doing that by walking behind all your cows today, 1 week in the future, and then doing that 4 times in total, this app would send that data set to the cloud where my model is, and the cloud would, my model would produce a prediction for, okay, if you let this go the way it's going, then you're going to have so many M4 lesions, so many M2 lesions, so many M0 lesions in the long run. Is this acceptable to you, or are you heading towards an outbreak? And with this prediction, you could have an idea, okay, we're heading towards an outbreak, which is an intolerable amount of M2 lesions or M4 lesions. We need to intensify our preventive program. This is something that will be available in the very short run. And while you're doing your pen walks, you can think about cow leg hygiene, and on our website you can find these hygiene scoring charts. You're thinking about, is there a hygiene problem in this barn or not? So there's lots of benefits towards doing these regular pen walks. I talked about the long-term sequelae of digital dermatitis, and by doing claw measurements throughout over time, Arturo Gomez, one of my colleagues and collaborators, he has discovered that digital dermatitis lesions are prone to lead to heel hole erosions in layers, since digital dermatitis appears and disappears in a periodic fashion. The heel hole erosions that occur, which result from this disturbance of horn formation, appears in layers, like the layers of an onion. And those heel hole erosions, and in the long run, they are part of this heel horn overgrowth, and that leads to sore ulcers in the long run, and we have the numbers to back this up. Digital dermatitis leads to different claw angles. The so-called block claws can be lateral, medial. As your cow develops digital dermatitis, the hygiene problem that results from deeper interdigital clefts exacerbates itself. It's like a vicious cycle. Digital dermatitis leads to deeper interdigital clefts, which then create worse hygiene, which then predisposes to more digital dermatitis. So again, please be aware of the fact that digital dermatitis is not a short-term problem. This has long-term sequelae, as presented during the World Pediatric Congress in Lisbon in 2012. And again, as a poster during the Lameness conference in Bristol. This is why we are talking here today. In conclusion, we would like to digitally precondition our heifers and young stock and then the dry cows before calving to prevent DD from reoccurring. Currently, I know that vaccines against digital dermatitis are being reconsidered, and there's a need for additions and alternatives to the topical treatment protocols in the face of these clinical records, in the face of knowing that there's a clinical cure apparently, but the microbiological cure due to these insisted treponins may be lagging behind. You have to detect your M2 lesions early, use adequate topical treatment agents, and prevent the chronicity of digital dermatitis by using your optimal hoof bathing strategies and good recording of claw lesions. And I want to emphasize these DD pen walks as a preventive measure again.